and we're so glad to see all of you. You have joined, of course, the February version of the 360-degree volunteer engagement idea exchange. Today's topic is implementing 2026 priorities, deepening impact through volunteer-led innovation. And I just realized there are two things in this topic that are going to be very important for us this year. And innovation is one, and volunteer-led is another. So those are two aspects of the same work that we're doing. And I imagine most of you have been involved in one way or another in planning for 2026. There are priorities that are out there, I'm sure, for every state. And what we hope to discuss today and hear from you are ideas about how we can make sure that our volunteers are being the innovative people and we're using the innovation that they can bring to the priorities that are being set. So, Dr. Mary, I believe you have the first question.
Yes, and I just want to say again, thank you to all of you who have joined us today. And if you haven't had a chance to either add your state to your name, or you can place it in the chat, and Deborah and I will be glad to add it. We always like to have everybody be able to see who's in the room to see where all these great ideas are coming from. Um, and right now we have quite a representation just as our meeting is getting started. So thank you all for being here. Our first question, I put it in the chat and I'll read it also. Um, as we're talking about innovation and volunteer-led, how can volunteers be empowered to identify emerging opportunities for local impact? And I know that we're going to have some great responses to this because our volunteers know the community so well and so intimately. And it's always amazing to hear the different things coming from the different areas. So, who wants to be the first to chime in on this question? How can volunteers be empowered to identify emerging opportunities for local impact? And if I can just restate it, what opportunities for local impact have you already identified, some that you've already done that you'd like to share with the group? Anyone want to get the conversation started? Little things, medium-sized things, big things, all things are certainly welcomed. And I'll just give that a few moments to marinate.
And I'm going to say, Mary, you are so much better at this than me because you do allow people space. But I want to tell you about something that just happened in a meeting just a while ago.
Okay, and
Um,
then Dennis, I saw Dennis's
Dennis
hand,
has
so
his hand up. So, Dennis, do you want to go first and then I can tell?
I'd be happy to. I guess from previous activities, when I was leading the Chattanooga team,
Mhm.
uh, we had a number of volunteers who would be involved locally with city government activities, faith-based activities, other senior centers. And as long as we notified them of what our focused goals were for the year, they could keep their ears open to opportunities that may align with our goals that are happening in their uh, different social groups, and giving them the ability to throw out ideas based on where our focus was. And hearing that something's happening at the local level gave us opportunities to develop or build partnerships with those new entities. So it's a win-win for everyone.
That's a great way to do it because I think a lot of times um, organizations or individuals may not know the depth and the breadth that volunteers can assist with. And so that sharing of information certainly is an opportunity to provide that information and to provide those partnerships. So thank you for sharing that, Dennis. Let me see. Mike, you want to come off as um, mute and talk about what you put in the chat?
Sure, yeah, thanks. I don't get a chance to join these very often. So hi, I'm excuse me. I'm Mike Kulik with the Office of Community Engagement, based in Pennsylvania. So I'm joining from the east side of the country. Yeah, this is just one of those things that I always smile when I get this question because I've seen it with my own eyes how volunteers of they've one day on the job to 10 years on the job really have found a lot of value at it doesn't have to be movies for grown-ups specifically, but movies for grown-ups, we get a lot of people that are very energized around movie topics. So just having a very simple but catchy, sort of what matters to you in this community sign and having jars with marbles and you can, label those jars with whatever you want. But I had just suggested, caregiving, fraud, healthy living, which are obviously sort of larger buckets of work that we focus on with our social mission. But you can get more creative with it. And really that allows people to say, hey, how are you? Drop a marble in the jar. And it's an instant listening activity that the volunteer can then own, count the marbles at the end of the event and bring that back to their staff lead to really give you, a real-time look at, wow, it looks like 85% of people that came to this movie think that caregiving is something that we should focus on. We should probably make sure that we're baking some caregiving events into our community work this year. So I just wanted to offer that as a really, cheap, easy, sort of light touch way that has real value.
Thank you. And I've seen that several times, and it also allows for some engagement. Depending on how many people are there at the table, some engagement might even generate some more ideas. So I like that idea a lot.
And while I'm on camera here, the other thing I just thought of, which I know this is a very big deal for the association now, and the OCE team, we're kind of trying to figure out how we can put this into practice locally with staff and volunteers. We're really wanting people to sign up for an AARP.org account, which is free, right? And to download the AARP Now app. So if you do a sort of scan of your volunteer team and you've got somebody who is tech savvy and or has downloaded the AARP Now app, kind of knows it more than your average Joe or Jill, have them set up at an event and just say, hey, have you downloaded the app? They can kind of talk like a real person about it and show people where to go, how to download it. And I mean, that's a real measurable, piece of information that we're all hoping to further this year. So I wanted to share that as well.
Thank you. And as an example of a leadership role, that can be a little L depending on, somebody that's likes to be involved with the community and is, easy to engage, or it can be a big L because if you're looking to engage people in technology and with the app, that can be a pretty major role in getting more engagement in the community. So those are some of those roles that somebody might just say, yeah, I can do that. I can sit at a table and I'll be glad to help people download the app. So great idea, Mike. Thanks for sharing that.
Thanks, Dr. Mary. We see.
Anyone? Oh, Mary, I see your hand.
So I just wanted to say that we not only have volunteers that are at a table. The one thing with the movies for grown-ups I have found is a lot of people want to get registered so they can get their seat because they want to have a good seat for the movie. Nobody wants to sit in the front row. But while they're standing in line, we do have volunteers that actually go and engage with the people. The last movie we had a volunteer who went and just asked them, the things that they would like to see with AARP. I do agree that I think if you've got a volunteer that's involved in a senior center or another organization, it's a good way to kind of, I guess you could say, get your foot in the door because they're passionate about this other organization. And if they're passionate about AARP, they'll help you find a way that you can go and have an activity that's together. So those are just a couple of things that I found that seems to work is sometimes they will go to the table, but sometimes you actually literally like have to maybe stand in front of the table or you have to engage with them in the line. Just to give them a little bit more. The other thing we did find out is, and this happened with a couple of our ice cream events, is people thought we were, because we do a theme, people thought they were there for a presentation. So we're trying to figure out a way that we can do an ice cream event and we can still give them a little bit of a presentation, say on fraud or Social Security. I don't know how it's going to work. We're looking for different ideas.
Okay, Mary,
Thank you.
while, and I'm talking to Mary Roberge, while you've asked the question, and we've had ice cream events in Kentucky. So I just kind of jumped in here. And we provided fraud presentations while people were sitting. Okay. After they, as they got their ice cream and, to kind of schedule them around, we were using the photo booth kinds of things so they could stop at the photo booth. And then, they're ready to sit by that time. They've been, and it doesn't take long to do, one of the brief fraud presentations, give them some materials, and some of them, they like to sit for a while after that.
Oh, that's a great idea. Thank you.
And that kind of leads into the second question that I have, both what you and Mary have said is how do you involve or encourage, how have you involved or encouraged volunteers to think about or develop new ways to approach community and or executive council designated priorities? And um, you know, like you said, Deborah, using a ice cream social or a movies for grown-ups or something like that, and then having just a little presentation that ties on whatever that priority is, without it being a full-blown, really long program, just to get the community interested. Are there any other communities or any other volunteers that have done or thought about things to develop approaches to community engagement that we'd love to hear?
This is Joyce from Ohio.
Hi, Joyce.
Hi. So when we do our movies for grown-ups, we usually do a 5-minute talk before the movie, and we tell them all about AARP and how we would love for you to volunteer if you have the time or whatever. So we take that opportunity to do that.
And that's just a light open the door invitation, and it's not going to be long because they're there for the movies for
Right.
grown-ups.
Yes.
And that's a nice way to plant that seed. Thanks so much for sharing that, Joyce. Any other ways?
Okay, this one,
Mark.
oh, okay.
Yeah, I don't know if this is appropriate or not. But I'll mention it.
Always.
I'm a volunteer here in Minnesota, and one of the things that we implemented here in the last year was, in addition to the executive council, we've implemented a volunteer leadership team. So they are typically we're typically senior representatives from advocacy, community involvement, our information center, our fraud specialists, that sort of thing. We get together on a quarterly basis, and we in turn have our own teams of other volunteers. So we get together quarterly to kind of figure out what it is we need to work on. We then go back to our sub teams and spend time dealing with exactly this kind of question. How do we get more people into the advocacy role? How do we to talk about our priorities? How can we better utilize across our different disciplines of speakers team, of advocacy, of fraud watch, that sort of thing? And then we come back together and share those ideas, and then take those back to our folks to talk about and work on.
Great. That's a wonderful idea. Thank you for sharing, Mark.
Yeah, no one should hesitate to tell us something either you have done, something you've seen, something you would like to see. Any of those options are fine. Because this is a chance for us to talk about what could possibly happen. And while we're waiting for a few more ideas to bubble up, wanted to tell you about one that came up today, and that was from a staff person who said a volunteer or several volunteers have come to me and they want to get involved in helping in disasters and are willing to take that right now. But the staff person was hesitant because they said, we don't really have time to do that. But they were going to lose this group of volunteers if they couldn't figure out a way to use the energy that these people were bringing on. So, has anyone faced a question like that? Mary?
So when you said emergency,
Mhm.
our Speakers Bureau did a collaboration with the American Red Cross.
Aha. Okay.
And there was a lot of work behind the scenes, that the local state office did with the Red Cross and also with National to make sure that we have a presentation that abides by all their guidelines.
Mhm.
I say if you want to have more information about that, to contact Pam Doobie at the New Hampshire State Office, because she was a staff person along with a volunteer, Iris, who made that happen. And it's a really great, it's basic Red Cross safety stuff, but it's a good presentation.
Great.
That's an excellent suggestion because we know the Red Cross has all the basics of emergency preparedness and disaster relief. And so that would be a natural partnership. And I'm sure that they would be thrilled to have interested AARP volunteers who, are interested in helping with that mission. So thank you for sharing that, Mary. That's excellent. I know one of our colleagues had mentioned this, Deborah, in the North Carolina area because of, the disasters that had happened in the mountains last year, that's something that's on the kind of on the forefront of a lot of people's minds now because with our weather changing, more and more disasters are occurring. And I think that's a wonderful opportunity for volunteers who are interested because that's a specific skill set and a specific ability to want to handle disaster relief, and so I think that's something that we can share with many of our volunteers in our areas to see who might be interested with that as well. And I see Gloria has her hand up from Florida. Gloria, what do you want to share?
Yeah, sorry for not showing my face, but I'm doing you a favor. One of the things where we've encouraged volunteers to think about new things and how to approach community, we do in the livable communities area, we've done a number of walk audits with our transportation authorities. And we get people out in the community walking that stretch, maybe it's a mile or so, and getting acquainted with the transportation folks, attending meetings later to see what improvements have been made. And livable communities is kind of, I mean, we've worked on it a lot down in South Florida, but and in the state of Florida and across, I mean, we have over 1,000 communities now that's part of the Age Friendly initiative. So so that is one way. Another thing we've done is walk with the doc, and I think that's probably around the country also. We do it on a monthly basis. I know they do it in other parts of Florida, maybe even more frequently than we do down here. So those are some things that not only gets people outside of their house, but learning new things.
Thank you so much for sharing that. Excellent, excellent suggestions. So as those questions marinate, I have a couple more that I'll add in the chat to think about. As a volunteer, how would you like to be involved in developing new approaches to community service? Or are you already involved in developing new approaches to to community? And the second part of that is, what new roles or responsibilities will help volunteers shape the 2026 priorities from the ground up?
And
And I
while
see,
people are thinking about that, are you going to tell them about what Mike put in the chat again?
I am. Mary put
Okay.
something in too. She says we have a table at the local police senior walks that are held in the spring and the fall. Wonderful place to be. And a great suggestion. Walk with the Doc is an OCE funded program that we're hoping to continue scaling in communities nationwide in the future. But states can design and carry out their own walking groups outside of Walking with the Doc model if they want to get started right away. And Jen Byer and the Wyoming team have an excellent one. Jen Byer and the Wyoming team have like 7,000 programs for I'm exaggerating just a
It
little
does
bit,
seem like that sometimes,
but
yes.
with the small staff and all those volunteers there, they have so many programs, and I take advantage of many of them. So thanks for putting that in the chat, Mike. That Jen does have an excellent one, as I'm sure others on this call do. Anybody have anything? The group is quiet, and that's okay because it's cold, and I think, I'm still kind of thawing out from being a week in the sub-zero freezing temperatures. But if there's anything that this conversation has sparked for you, just please feel free to share it because we want to hear other voices other than mine and Deborah's. Becky, thank you for raising your hand. What do
Oh,
you have to
Mary,
share?
I had to chime in a little bit. It's been quite a while since I've done that. Here in Oregon, I put myself in a rural situation, so I'm not in a community action area, but I still try to get involved. And our West Metro Cat, if I'm out there, I can attend their meetings, and they're very gung ho as far as new inventive ways to get our marketing and our words out to the community. They've done quite a few different combinations of well, the last one, for instance, was bringing in more volunteers, but not only that, but telling our story as far as caregiving or advocacy and how we do that. we had tables at the library. Each of our teams, the advocacy team, the community action team, all the caregiving team, and people just came in and we talked, and they did a round robin. From my perspective, if I want to get something done out here in Woodburn, then I need to come with a package and present it. I know that staff is very overwhelmed, not overwhelmed, but up to the capacity level and flowing. So the more we can do as a volunteer to present to them a complete package. They want to know, the summary of everything and how it's going to go. What kind of plan? What's the idea? How do you make it happen? And what's the results? And fitting into the priorities of the state and national. So that takes a lot of front work, and you got to be really quick because things change constantly. Right now, we're going to be approaching fraud season, for instance. And so if I want to do something in caregiving, which is later in this year, then I need to start now to have something together if I'm going to present something out of the norm.
You're right. Very good ideas. Thank you. Mike, did you have something to add?
I do, Becky. Thank you. And Becky, which state are you in again?
Oh, I'm sorry, Oregon.
Oregon. Okay, on the other side
Yes.
of love Oregon. Yeah, so I, in addition to working with the large region states for OCE, I actually co-lead our rural engagement work across OCE along with our VP, Brad. And I will tell you, and hopefully this will make you happy, we are putting a lot of our eggs in the basket around rural caregivers this year, and really just creating awareness around resources that are already available to rural caregivers and just making it easier for them to connect. I think it's 1 in 5 family caregivers live in rural in the United States. So pretty large. And 34% of rural caregivers say affordable services are hard to find and they just don't know where to go. So love all of your ideas, Becky, about working with libraries. I feel like that's one of those trusted, gathering points in community and rural and otherwise, but especially in rural. So really interested to maybe connect with you in the future. And Kim Bishop, I think, is your advisor for Oregon. But
Yes.
anything that we can learn from volunteers about how to further the rural caregiving message would be great. And a lot of you may or may not know, AARP has a partnership with 211, which is a United Way program. I don't know how many of you know this, but it's not in every single state yet, but quite a few states across the country have an AARP 211 connection. So if somebody picks up and says, I think I need help with caregiving, I just don't know where to start, they actually have a whole set of resources and scripts powered by AARP that help drive them to our resources and to trusted resources outside of AARP, but also local to the community. So we're realizing a lot of people have no idea about these because we really haven't done a lot to fund that. So I'm actually going to be driving a lot of that work so that we can get some awareness campaigns going in rural communities. We might just have to pick out a few to start, but would love some ideas. If you have any, Becky, or anybody else on the call, you can drop it into the chat. I can give you my email. I'll put it in the chat if you want it. Really would love to make sure that we're incorporating our volunteers into that rural engagement model. Obviously, we're doing a lot in November around caregiving with the big blitz for Caregivers Month. And, of course, we're doing a lot with fraud in April as well, which I know also is, very important in rural communities in particular. But I just had to come off mute and say thank you, Becky, because I really appreciated you sharing that. And you've got some really great ideas. And on a lot of times, it's just starting small and gathering in a place that's trusted. And, you build a lot of, headway with rural areas in that way. So thanks.
Yeah, I was a caregiver and my aunt and uncle when my granny passed away, and they were definitely in a rural area, not only away from Portland, the main central part, but out farther. And so it was really difficult. They rely on family, and the bigger the family, the better the family is equipped for caregiving. but that doesn't necessarily ring true all the time. So yeah, I would like to see more resources available to them. So thank you.
Yeah, thank you.
Thank
I just
you.
dropped my email into the chat, so feel free to, if any ideas come to you whenever, I'm always open to that. Thanks.
Okay, perfect.
Thank you both. I see Steve with his hand up, and Teresa, do you have your hand up too?
Yes, I do.
We'll go Steve and then we'll come to you.
Sure, no problem.
Thanks. And unfortunately I can't be on video, but I'll try to be quick. First of all, I just want to give a shout out to Mike's work. I think his approach that he's been working on with the rural outreach is exactly what we need to be doing more of at AARP. If you look at where we have volunteers and activities, it's no surprise that they're generally more often in the metropolitan or urban areas because we have more members and more volunteers in those areas. And often that's where the state office is located for many good reasons. But if you look at where we need to really demonstrate our value, particularly I work in the campaigns department, particularly in the area of how do we build relationships, for example, with the select person or the sheriff in a rural county who might become the next congressman from that county. How are we doing that effectively? And I work on a project that's the Grassroots Field Program project, which only started last year, and we are picking away at trying to figure out how to recruit volunteers and empower them to do exactly what you were talking about, Becky. It was music to my ears. Sort of develop a plan, develop your own approach to what you'd like to do in your area. Bring that, obviously, to your state office so that they have something to look at, something to review, and hopefully approve. And then go out and execute it. And we aren't pushing this everywhere yet because we are trying to develop some tools behind the scenes. For example, how do we track meetings that are happening and things like that, a CRM for that. But as we build that out, we're also building out an issue platform that really leans a lot on programs and other things that are available. So we walk into places showing our value first and not asking for help on advocacy right away. So just very excited to hear about your approach, and I'll also throw my email in there. But Mike is the lead on all the rural stuff, but the areas that I'm focused on, the vast majority are rural as well. So Mike and I talk along with some of the folks over in local advocacy who are also doing some work in some areas that aren't as urban. So I just wanted to share that with you all, and I'll put my email in. And if anything I talked about sounds of interest to you, please let me know.
Thank you, Steve. Teresa, and then Becky will come to you.
So, good
And
afternoon.
Teresa, what state are you from?
I'm from Northern Virginia. I used to be part of this program, I guess you'd say, but 2 years ago, I had to quit because of illness. And now and I have been for a long time with community outreach. Amber, if any of you know her, in Northern Virginia. So when you're talking about libraries, I thought I should just let you know one of the areas I'm very involved in, and it's assisted living in one of the areas in Northern Virginia, Reston, and the one Kensington. Almost every month, they've had a series called Ask the Neurologist. And you have all the caregivers and people who are interested. And, the topics have been on Parkinson's and dementia. And so many people come and they said, how do you become a volunteer? We think it's great. And what do you do? And I said, well, I get to know people and they call me their local caregiver. Obviously, I'm not in medicine, but just to be able to talk and to have a conversation. So that has been very, very productive, the assisted living. Now, I think the library is a great place also. And, it's just many times people want to do something. They are caregivers. We've had quite a few series on caregiving as part of community outreach. And it seems to be the one area. We had one, I guess it was in late December, early January at the Fairfax County Government Center. And we had over 300 people attend. And we have vendors there as well, and we have speakers, and all downstairs, vendor everything they have to offer in terms of assisted living. How can you help people who are at home? You know, the whole idea of some kind of a device that has the time, that has the date as well, that has the day, anything. I mean, we can come up with, many examples. And just from my experience, I think it has been very, very productive and helpful. So
Well,
sorry, I
thank
went on a
you.
little bit longer than most of you.
Oh, no, 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 no. Both of those are tremendous ideas for community engagement. And it sounds like that last event that you described was wildly successful.
Yeah,
So thank
it
you for
was.
sharing, Teresa.
You're very welcome.
Becky?
Thank you.
Yeah, Stephen brought up a key word for me, and that's CRM. Does AARP have a CRM system in? Because I am a volunteer lead for the do-it-yourself work group who provides support for the Speakers Bureau across the nation. And we have been looking into that. We do tracking. Each speaker bureau does their own tracking. So I was just wondering if there's one available.
That sounds like a staff question.
Yeah,
I can
probably
give
not in this one.
I'll give a quick answer. We have numerous CRMs. The CRM that we're looking at is really non-member focused, right? So not
Okay.
consumer focused, but about relationships. And some programs, and I'll reference Bill Armbruster and the Livable work, right? He has his own CRM that he had to go out and build himself, basically. The programs team did because we didn't have one for that. So that's where those 1,000 communities that I heard mentioned earlier, that's where our contacts for that live. But we do not have what I would call a supporters network CRM. So, for example, if we had a list of 800 people who were not AARP members and not volunteers and didn't want to double opt into AARP, we don't have a way to speak with them or even organize that. And so that's one of the big projects that I'm working on right now. Because the idea would be, Becky, that you go out and you might meet somebody and they might say, hey, I'd like to stay informed on what's going on with Social Security, but I don't want to be an AARP member. I don't want to be a volunteer. Where do we put them? And they could live in our UMP system, but many people won't double opt into that email approach. And so we're trying to work with folks to develop a system there. So that's a long answer to your question. There are numerous CRMs at AARP, but not one that fits exactly what we're trying to do in the community supporter space.
Thank you.
Well, thank you, Steve, for that comment. And thank you, Becky, for the question. I just want to make sure that we're all on the same knowledge base here. What's a CRM?
It would be it could go either way. Some people would call it a customer relationship management tool. Others, and this is what I choose to call it because I don't want to call it customer, a contact relationship management tool. And that's usually a database of names, notes. I'll put it this way. When you call your internet company and they look up your record and they look in the notes and they say, we see you called on June 22nd and asked for the service to be turned on. And I don't know why we didn't or turned off. That is them looking in their CRM, if that's helpful. And it also usually provides communication options like email or phone calling, as well as depending on how big you go, it could provide things like content and scheduling and things, but we're looking at more of a basic approach to start with.
Okay, that's great. And thank you very much for giving us that explanation.
Sure.
I did notice there was one more comment in the chat, and I think it was Mary was asking, it's Mary Roberge, was asking about libraries in terms of if we had a presentation like Becky was talking about, was it with other groups or could it be a table by itself? Is that what you're asking, Mary?
Well, no, I was kind of curious because she said if I heard correctly, when you were at a library, you had different tables for the different ways people could volunteer, like advocacy or pass out information like advocacy, Speakers Bureau, fraud. So I was just wondering if that was a special like night, maybe that the library had set up that AARP could go with, 4 or 5 tables to talk about the different, things that they do and the resources.
It was
Or
it
was it?
was definitely set up for a one time, but I do like the idea of working with the library and having a rotating table for different teams that we provide here in Oregon, um, manning that at a small time. The only problem with that is you're in one library, and so it's not really getting out to everyone, but it's a start.
And I've
Thank
seen
you.
that model used for volunteer orientation or just kind of a volunteer um, annual kind of sharing what we do so that other volunteers might be able to expand their interest in volunteering as well. Maine did a wonderful, I don't remember what we called it. I'll just say it was like a chat and chew. So it was set up where all the different groups had a table, and every 15 minutes, people would just get up from one table and move to the next, and the presenters would present about what it was their group did. So it's a very effective model that can be used either externally for the community or internally for volunteer engagement.
That's interesting. This is Joyce from Ohio. I lost my camera, but let me see. Yeah, so we do something, and we've done it for maybe 3 years, and it's very, very successful. And it's called Stepping Out and Stepping Up and Stepping Out. I think that's what it's called. So we have taken it now to another area of Ohio. And what it is pretty much what can't remember her name now was saying, but we have it's really neat. I think they are thinking about branding it seriously. We have different cards that we've written up, and when they come in, the cards might talk about the different things that we present on, because we have a pretty nice speaker bureau here. So I happen to be the scheduler of all our events. So what they do is they talk about each presentation that we do, and what the purpose is to try to get volunteers to come and be a volunteer. And we have it set up where you can, whatever card you pull when you come in, that's where you start, and you go and you sit and you listen to a little spiel, and they tell you about each time you move, they're telling you what. And it's worked so well until we've taken it to Delaware, Ohio now. And when we did that there, I think we had over 40 some people to come out. So now they are thinking about going to different areas, doing this stepping up and stepping out, I think it's called. So
Thank
it's
you.
working.
Yeah, it sounds like that same model. Thank you, Joyce.
Mhm.
Becky, we're
Yeah.
winding it down, so
Yeah.
I'll give you the last words before we turn it over to Deborah.
Well, Joyce, I wanted to thank you for all of that. We've been talking about doing that, and we haven't yet done the 15-minute round robin or whatever you want to call it. But I
Yeah.
like the way you do it, and you got a large population to come visit. So I'm
Yeah.
curious on how you did that, and
Right.
maybe talk offline.
Oh, sure.
Okay.
hmm
And Mary identified it as snack, sample, and serve, and so that's kind of the model that that I was trying to very poorly describe. But thank you, Mary. Deborah?
Yeah, now we've actually come to the end of our time. I've been putting in for everyone the invite volunteers into leadership. The next session of that is going to be on March 25th, or it starts then. and they're only offering it 3 times a year. I put the registration link in if you were interested. And if a volunteer wants to go, they need to have a staff person and vice versa. But it's a training course that's available. It's one of many things that are being done by OVE. We're also providing training for the Cultural Leadership Development Series, which is the diversity and inclusion training. We've got a session where we've stepped up the numbers of overview sessions. We've got one tomorrow and then on the first 2 Wednesdays of March. So if you're interested in learning how to be a more inclusive volunteer or being with some people to talk about that, feel free to check out the state volunteer chatter group on the portal or be looking for emails potentially that might provide you additional information. So,
Deborah,
yes.
I saw that information, and I was wondering if this is a series of where one is dependent upon the other, or can you just jump in on any one particular one?
What we encourage people to do, because of the just making sure we're comfortable with the terms and so on, is session 1. That's really it. That's the overview. We cover every single topic in that, not in depth that you could in the others. The big difference we made this year is that you can take one and that's it. Or you can take anything else you're interested in at your time period. It doesn't relate to us. You can do it on your, no order is required. So, used to be you got to take one, then you go through all of them to get through 5. You don't have to do that anymore.
Okay, thank you.
Okay. So if you sign up for one, that's all you're committing to, unless you choose to do something different. Okay.
I like
So-
that flexibility, Deborah.
Well, and that's something I think you're going to be hearing more and more about from OVE, is keeping the flexibility, allowing our volunteers, all of us, to be able to do what we want to do in terms of service to our communities and to this organization. So I want to thank all of you for coming today. We will be here again on March, and we will be having a panel discussion to lead us off in March. And in April, we're going to do something a bit different as well. We've got a person coming to help us deal with self-care. And we're going to have some ideas about how to share those with our volunteers and our staff. So it's so good to see all of you. Thank you, Dr. Mary. You've just been wonderful.
And thank you, Deborah.
Thank you to each of you. All of this information, this recording will be posted to our chatter group, and any materials that you provide us will also be posted. So thank you very much.
Thank you all for sharing such wonderful ideas today.
Yes, thank you.
Thank you.
Have a
Stay
great day.
warm.
Yes.
Yes.
Take care.
Survive until we're warm again. Yes.
Thank you very much.
Bye-bye.
Goodbye. Have a great Tuesday. What's left of it.
Deborah, you want to stop the recording?
Yes, ma'am. Good idea.